Okay.
I'm writing an op-ed piece right now, and it's called Treat Early to Save Lives, The Tale of Three Patients. I'll explain really briefly. So one patient is a 77-year-old woman that called me shortly after testing positive. No symptoms whatsoever, but she's got underlying significant health problems and she's scared. She tested herself because she got exposed to a grandkid or a relative that was positive with symptoms, and so she tested, and sure enough, she's positive. We immediately started her on zinc and some other supplements. It's now been eight days. I just talked to her this morning. Other than a little bit of nausea from the medicine, not uncommon,
Right.
she has no symptoms. She's doing well. She's got, I think, a day or two more of treatment, and then she's done. So we've prevented her from clinical manifestation of the disease. Patient number 2. Younger guy calls me after 2 days of symptoms, positive, and he has symptoms. And those symptoms were high fever and a really bad cough, one of the worst coughs, dry cough that he's had. He couldn't stop coughing. Every time he'd take a deep breath, he'd cough. Started him on the usual treatment with him because he had respiratory symptoms. I used inhaled through a nebulizer, like an asthma machine, inhaled budesonide. Budesonide is an older generation asthma steroid, super cheap. It's been around for a long time. I learned about this through Dr. Bartlett out of Texas. Just spoke to Dr. Bartlett a couple days ago. He's had almost 100% success rate with this. So zinc, Z-Pak, inhaled budesonide along with some other supplements. 24, 48 hours later, fever is gone, cough completely gone. Now 7 days later, he feels like he was never ill.
Good.
Patient number 3, finally. A new patient to me. The wife calls, frantic, wanting my help and intervention. This patient was sitting in the emergency department of a local hospital with a fever, shortness of breath, and going downhill really quickly. And he was 57 years old, and he was about 2 weeks into symptoms. His own doctor said, "No, just stay at home. You'll be fine. Chicken soup, whatever. Give me a call if things get worse." Well, the wife gave me a call. Now he's on day 5 of remdesivir in the hospital. This particular hospital does not use hydroxychloroquine. Unfortunately, I would have. And thank goodness he's now feeling better. Yesterday his appetite came back. He's starting to eat. He's needing less oxygen to keep his oxygenation levels at mid-90s. And now, in talking to the infectious disease doctor at this hospital, we're both very confident that he's going to completely recover. He didn't need a ventilator. He didn't end up in the ICU. So we're getting better even without. And we're getting better at treating this illness. And if you look at the statistics, you'll see hospital stays for COVID-19 is shrinking. The conversion of you're in the hospital and now you go into the ICU is decreasing. The number of deaths from COVID is flattening, and we're just starting to see it decline. And even the number of cases that we were supposed to be alarmed by is now flattening out as well. And by the way, while we're talking about cases, we shouldn't be surprised. There's no surprise that there's a number of cases. Governor Newsom shut down our economy in California hard and early. And as a result, California was like, I don't know what New York is complaining about. We're good here. Then we open up our economy. We start to go about our business. And of course, people are going to get exposed and more people are going to get sick. So that's number 1, why cases are increasing. Number 2 is we're doing a boatload more testing. You test more, you find more. And then number 3, about a month ago, there was riots and protests all over the country. Hundreds of thousands of people still going on up in Portland.
Yeah.
We can talk about that. It's a crazy town up there. So you get all these young people that are out protesting. Lo and behold, all these new cases, average age, about 31 years old. I didn't do any surveys, but when you watch it on TV, there weren't a lot of 80-year-olds that were throwing bricks.
Yeah, right.
Mostly just young people. So increase in the economy, more testing, protesters, that's why we're seeing increased cases. And by the way, if you look at areas that were slammed hard early, like Manhattan, guess who's not having a spike in cases?
Exactly.
Why aren't they having a spike in cases? Because they were hit hard. There's a level of immunity that is occurring now in places. You know, I get criticized for even bringing up the word herd immunity,
Right.
but I think it might be a thing.
Well, you look at Italy, who was hit hard. Now they're getting almost no deaths. Now.
Right? Yeah.
Spain.
India, same thing.
Yeah.
So listen, I don't want to mislead anybody that this is not a deadly serious virus. It is, if you're in a high risk group.
Yeah.
We're still seeing about half the deaths are in nursing homes.
Yeah.
So when Governor Cuomo takes recovering COVID patients into empty beds in nursing homes, huge mistake.
Yeah.
Huge mistake. Now I don't impugn motives on him for doing so. It was a mistake. He didn't know, but nonetheless, it was a bad mistake. Not all governors did that, thank goodness.
Right.
But about 50% of people that are dying are in those high risk groups in nursing homes.
And then
so
they say
forth.
the median age is like 78 for the deaths.
Yeah, I think it's actually closer to 80. In Italy, it might be a little higher. They've got a slightly older population. So if you're in a high risk group, be extra careful. And if you do test positive or have symptoms, let a doctor who knows how to treat this know immediately. If you treat early, really good chance of recovering. You treat late, especially if you're in a high risk group, boy, it's tough sledding.
Yeah.